Hi everyone, I am Michelle Jane Sevilla and today I'm going to perform open gloving return demonstration. This procedure is important because wearing gloves help protect both patients and health workers from infections. It also reduces the risk of germ dissemination to the environment, as well as it reduces the risk of the transmission of microorganisms and harmful pathogens from the healthcare worker to the patient and vice versa. Of course, the materials that we need to use in this procedure are sterile gloves and our trash can right here. So completeness and organization of our equipment ensure our efficiency as nurses. So before conducting this procedure, I performed a thorough hand washing. We must remember that the use of sterile gloves does not replace hand washing, so we must perform hand hygiene before and after every procedure. Now that we are all set, then we can now proceed with the procedure. Here is my sterile gloves. Make sure that the gloves are of the right size and that the packaging has no tears or stains. It is important to ensure that the gloves fit well to ensure user comfort and avoid contamination, because if the gloves are too big, then it would be harder to hold objects and would be easier for germs to go inside the gloves. Now, if the gloves are too small, then it is most likely to get ripped, or not, it may cause a decrease in the blood flow to the fingertips and may result to pain, numbness, and constraints in finger and hand movement. So now I am going to remove the outer wrapper of the package. Do this by carefully pulling the upper side. Be careful not to spill the inside to keep the sterility of the gloves. Then get the inner package and place it on a clean, dry, flat surface because moisture can contaminate the gloves, and the area must be at waist level because any object held below the waist is considered contaminated. Now we're going to throw this one. Now identify the left and right gloves and open the inner package. Be careful not to touch the gloves. And for easier application, we must glove first the dominant hand. So since I'm left-handed, I'm going to glove my left hand first. So to do this, I have to grasp the cuff. And it is important to remember that we can only touch the inside part of the glove to avoid contaminating the glove and ensure its sterility. Now insert four fingers and tuck in the thumb for easier application. So okay, now that we're done gloving our left hand, so now I'm going to glove my non-dominant hand, and to do that I had to slip my fingers beneath the cuff of the other glove and slip it to my non-dominant hand. And then put your four fingers again and then tuck in your thumb for easier application. So now that we are both done gloving our both hands, so now we're going to arrange it until we are comfortable. Now clasp our hand in front of our body, hold it away from the body. This is done to avoid accidentally touching non-sterile object and the front of our uniform. So since we are done, we are now going to remove the not dominant hand by getting the palm part and then remove it. So since we are done removing the glove of the dominant hand, now we're going to remove the non-dominant hand. Do this by putting our finger inside the cuff of the non-dominant hand and then remove the glove. And now discard this one. Perform hand hygiene after doing this procedure.